chance to go over your case history that you had filled out, and I had a few questions that I wanted to ask you before we went ahead with the examination that's going to be taking place today.
Okay.
So, Michael, can you describe your chief complaint to me about the voicing problem that you're having?
I'm just having frequently I'm like losing my voice, not to the point where I can't speak, but it just becomes so gone that when I try to speak,
Right.
You have to be close. You're not gonna be able to hear me.
Okay.
Yeah.
Okay. Have you had any surgeries? I know that you said no, but I just wanted to ask again have you had any surgeries or trauma in that area in your life?
Not that. I mean, not.
No.
No. I mean, there's
Okay.
some. I went to a concert once,
Okay.
but
Yeah.
you know.
What about any other medical problems?
No. Overall,
No?
really,
Okay.
really healthy.
Do you have any allergies?
No.
None at all.
No,
Okay.
no.
You did say that. I just wanted to make sure.
Yeah.
I have a question for you. I noticed you just cleared your throat. Do you clear your throat frequently?
Yeah. Yeah. It's
Okay.
something that's another thing that I don't know why, but I just constantly feel like there's something in my
So
airway.
you feel like there's something in your throat.
So
How often do you clear your throat?
I can't.
A day.
It would
roughly.
be like equivalent to how often like Gen Z checks their phone. Like
Oh,
it's constant.
so it's really
I
constant.
can't even count.
Okay.
It just comes like you noticed it before I even.
Yeah. Do you have frequent sore throats?
Yes.
You do. Okay.
Yeah, and I usually have them in the mornings.
So it mainly happens in the morning.
Yeah, and usually like as the day goes, I know after like I have my breakfast, it already feels better.
Okay.
And then as the day goes,
It gets better
yeah,
throughout
and
the
then
day.
I wake up the next day and it's like, am I gonna have it?
It's happening again. Okay.
Yeah.
What do you do for work?
I'm a high school science teacher.
Okay. So you're teaching.
Yeah.
Okay. We do consider that a higher risk profession. Just
For what? Suicide? No, I was kidding.
no.
I'm a high school teacher. I'm with the kids.
Oh, well,
a lot.
yeah, I get
you
that.
know, the hormones of the adolescence.
Yeah, no, it would be more so for the voice. So you're using your voice all day.
Oh, yeah.
That can be really straining on the voice, and that can really exacerbate anything else that you have going on. So, do you have a family history of voice disorders?
Not that I know of.
Okay, so
Yeah.
not that you know of. Okay.
Yeah.
Have you had a consultation with any other medical doctors?
I went to my general practitioner,
Uh-huh.
and he referred.
This is the referral.
Yeah,
Okay.
this is fine,
Okay.
yeah.
Do you remember the date when this started happening? Like the first time that you remembered, more or less, that you were feeling these symptoms?
Yeah, it was about August, beginning of August of 2019.
Okay.
So a year ago.
So it's been some time that you've
Yeah,
been
over a
living
year
with
now.
this.
Yeah,
Oh,
and I think it's because I lived with it, and I started to be used to it, and then I started to think,
Okay.
My wife started telling me like, I don't think that's normal, and we went to the doctor and started talking, and that's
Okay.
how. But it took a while.
Okay. Okay. So it's
To
so
identify.
you've been really dealing with this for a while now.
Yeah, I mean, at times when I lay down, when I go to bed, like my wife started complaining because I just kept clearing my throat. So I'm like, okay,
Yeah, I could totally see that could be
all right, honey, I'll go to the doctor. Let's
very
go figure it out.
disruptive to her sleep.
Oh no, no, but it would be worse. So I go to the bathroom in the middle of the night, I'd wake up, go to the bathroom, and I'd be fine. But I'd be sleeping, right? I go to the bathroom, I come back to go to sleep next to my wife, and the second I lay down, all of a sudden it's like, and then it's like.
What are you feeling when you lay down?
Like mucus is like, it's like a faucet, the leaky faucet just keeps dripping.
So where does it feel like it's dripping from?
I think it's coming from my like sinus because it feels like it's being pulled down. So
Okay.
it's coming from the top down.
Okay.
And then I feel like I need to get it out. So
Right.
I'll try to like contort and then I start coughing and try to cough in certain ways.
Yeah.
And then
And it
I'm
doesn't
waking up
really
my wife
help
and
it,
then I'm
and-
sleeping on the couch the next minute and it's just too much.
So I gotta ask you, are you as a teacher you do tend to talk loud to be able to talk over the students?
Yeah,
right?
that was one thing that
You do
I
talk
noticed in the
loudly.
form. Yeah,
Yeah.
it's loud, but it's like more of I project so
Uh-huh.
the whole room can hear.
Uh-huh.
And then of course, high school students, so sometimes they'll be
Right.
distracted and they'll be talking, so I have to talk a little bit louder to get some
Right.
people's attention.
Right.
Yeah.
Okay. Would you say that your condition has stabilized since the date of onset, or would you say that it's gotten worse?
I'd say I'm like I'm at like a plateau of
Okay.
like worseness.
Yeah,
I've
so
hit
it
that.
hasn't gotten worse.
No, but it's stayed now consistent for.
It's consistently stayed the same.
Yeah.
Okay. So can you tell me, so and you said that this is something that you experience in the morning, you get sore throats, and what about in the evenings? Do you feel any kind of symptoms in the evening?
I mean, I come home from work and I'm just tired.
Right.
Like I mean tired and like my wife will start asking me things and I'm just like.
Are you just tired to talk?
Yeah,
Okay.
like talk about things.
Okay.
I think that might be because I'm talking all day.
Yeah, and that they
5
are
classes of
muscles, so you're
biology,
using those muscles just like you would use another, like your bicep at the gym. So
Sure.
if you do curls all day, at the end of the day, that arm is going to be really tired.
It's not doing any curls.
It's not going to do any more curls.
Right.
So I got to ask you, what is your diet like?
Well, I like Mexican food.
Okay.
But like, not like Taco Bell. Like, more authentic
Yeah.
Mexican cuisine.
Do you eat spicy food?
Yeah, oh yeah, I like spicy. So I'll get like.
Like how
Hey.
spicy? Like, and
Well-
how often are you eating spicy food?
So, I mean, everybody has their own spicy. Like habanero for me is kind of like mild.
Wow, that's very intense.
I know. I'm
I
like,
can't even smell a habanero
my
without
wife.
crying.
My wife says the same thing when I'm making the
She
salsa.
sounds like a great person.
Yeah, she's pretty awesome.
So there's a lot of spicy foods in there, and then do you drink coffee?
Yeah, two cups before I go to work, or maybe 3. Or
Oh,
my
wow.
wife might bring me one if she's available at lunch. She'll bring me a coffee.
She's nice.
Yeah.
So you're drinking quite a bit of coffee. Are you getting good
Is that
sleep?
a lot?
Well, I mean, 2 cups in the morning and then 1 in the afternoon.
I try not to do anything after the afternoon, though.
Okay.
I don't know if
and
that means anything.
Are you sleeping well?
Well, aside from the,
Yeah.
I mean, yeah. I think I'd sleep better if I didn't have to like clear my throat when I try to go to
So
sleep.
you feel like it's inhibiting your sleep?
I think it takes me longer to fall asleep. I've noticed it's like significantly longer because I'm trying to like wait till my throat is like at this equilibrium and
Mhm.
it's like when it stops itching so much, it feels like an itch almost.
Okay.
Yeah.
An itch. Okay. Are you drinking any alcohol? Do you drink alcohol?
No.
No. Okay. And then I have to ask you: have you had a recent hearing screening?
Hearing screening.
Yeah. Like, have you had your ears checked?
No, they don't really. I don't think they do that on my physical. That's strange you asked me that. No, I haven't.
Then maybe that's something we might be able to do for you.
Okay.
Reading to you from a reflux symptom index, and I want you to rate each thing that I ask, each symptom I ask you about. It's going to be from 0 to 5. 0 meaning basically there's no severity, all the way to 5, which is the most severe.
Okay.
So the first thing I want to ask is, do you feel like your voice is hoarse and that you have vocal problems? So like when you're speaking, do you feel like that kind of rough voice?
I'd say maybe a 2 for that.
Okay.
Yeah.
And throat clearing.
5.
Okay, throat clearing. Excess mucus, post-nasal drip.
Yeah.
5.
5.
Yeah.
Yeah.
Difficulty swallowing food, liquids, and pills. No.
I think 0. Probably
Okay.
0 for that.
Do you cough after you eat or when you're lying down?
Yes.
Okay.
So 5.
5.
Especially when I'm lying down.
Okay. Breathing difficulties or choking episodes?
I don't have any choking episodes, but I definitely have sometimes difficulty taking in deep breaths because as I do, taking like my air, my oxygen, I feel like the phlegm is moving down, so I'll just like cut my have more short breaths so I can kind of clear it. So like when I'm coughing and stuff and trying to clear my throat, I'm not taking deep breaths, so that's definitely affecting my breathing. So maybe put that at like a 4.
Okay.
4, yeah.
Okay. Troublesome or annoying cough?
Oh, 5.
Okay.
Yeah. Sometimes it's really bad.
Okay. Really bad.
Like I'll cough and then I'll try to continue my lecture at my class and like I have to I can't say a few words and I'm like back at it coughing.
Okay.
Yeah.
Sensation of something sticking in the throat. heartburn, chest pain, indigestion, or stomach acid coming up?
I don't think I've ever had heartburn. I remember my grandparents talking about having heartburn, but I don't know if I have that. I don't feel any burning in my heart area.
What about in the throat?
I mean, there's like a few times I know that I'll like maybe regurgitate some food, which is not pleasant, but I feel like that's maybe like a one.
Okay.
It does
that one's
happen
a one.
sometimes, but it's not, I don't think it's not like consistent or very, very, very frequent,
Okay.
at least to my knowledge.
Okay. I'm going to be conducting a cranial nerve exam on you, and we're going to be going through each nerve that basically makes your muscles in your face move, and that from your tongue to your scrunching of your forehead.
Okay.
So what we're going to start off doing is we're going to have you open. Can you open your jaw for me?
Okay.
Okay. Can you close the jaw, please? Okay. Can you slowly open your mouth as wide as you can? Okay, just a little bit. Okay. Can you move your jaw from the left to the right? Okay, good. So I'm going to touch your face, and I want you to close your eyes.
Okay.
And I want you to tell me where I am touching your face.
Okay.
Okay.
So forehead, coming down to my temple, cheekbone, and then towards my chin,
Okay.
jawline, or
And
jaw, yeah, my jaw.
What side are you
towards my
feeling it
chin.
on? What left?
Oh,
or right?
this is my left side. Yeah.
Okay. And
Forehead, down to my temple, cheekbone, working my jawline to my chin.
okay.
Right side.
Okay. And this is for your, I didn't tell you, but for your trigeminal nerve. So this is going to be for sensation. And we're going to do the rest of your face right now. We're going to go, I want to just look at your face at rest and just make sure that you have symmetry in your face. Okay. Very good. Can you wrinkle your forehead for me?
Yeah.
Okay. Can you pucker your lips?
Like duck face? Oh,
Yeah. Like,
my students do it a lot.
yeah, I can imagine being a high school teacher.
Yeah, it's like, get off Snapchat for a second. Come on.
Can you smile for me? Okay, checking, just make sure the corners of your mouth are symmetric. Okay, can you?
Oh, the toothpaste?
Oh no, not this one.
No.
Can you frown, for me, please? Okay. Go ahead and round your lips and puff your cheeks up. Okay. Let's make sure. Okay. Can you, now I want you to open your mouth and I want you to say ah, and I want to be, if you can just keep your tongue down, I'm going to look in the back of your mouth.
Okay.
And just look at, your uvula, it's that little thing that hangs in the back of your mouth.
Okay.
And I want you to just say ah for me continuously.
Okay.
Very good. Okay, and let me see. So I'm going to ask you to open one more time, and I just want to take a look at the roof of your mouth.
Okay. Do I have to say ah?
You don't need to say ah.
Okay.
Okay. Just taking a look at your hard and your soft palate. And then I was able to hear your resonance and your vocal quality sounded good. Do you have a gag reflex when you brush your teeth?
Oh yeah.
Yeah. Okay.
Usually when I'm brushing my tongue, I'm like, oh.
Yeah.
If I get too far back, yeah, I definitely have.
Okay.
That.
Can you go ahead and cough for me?
Oh, and even when I did that, like a lot of phlegm comes up.
Comes up. Okay.
Well, at least it feels like it comes up.
Right.
I don't know if it's actually coming from somewhere down, but it feels like it's coming into my mouth,
Okay.
back of my tongue.
Okay. That's good to know. Go ahead and stick your tongue straight out and wiggle it for me from the right and then to the left.
Okay.
Okay. Can you move your tongue from the inside of one cheek to the other? So.
Okay.
Okay. Can you move your tongue tip from the top of your mouth to the bottom?
Top of my mouth.
So.
Oh, for like the roof? Okay.
And outside?
And outside? Okay.
Okay. Can you go ahead and say, I'm sorry. That was incorrect. I'm sorry. What I actually meant was, can you make the la 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 sound?
Oh yeah, la 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 la.
Oh, okay, thank you. I want you, so now we're gonna use a tongue depressor, and what I want you to do is push on the tongue depressor with your tongue. So we're gonna go first out, so I'm gonna put it right on your tongue, and I just want you to push against it.
Okay.
And then I'm gonna push on from the sides, from the right and from the left.
Okay.
Okay, go ahead. Push against, okay. And now stick your tongue out and put, okay, opposite side. Okay, perfect. Okay, I want to do a little assessment of how you feel that your voice is affecting your life, and this is from the Voice Handicap Index. So these are statements that many people have used to describe their voices and the effects of their voices on their lives. So I'm going to circle a response that indicates how frequently you've had the same experience. 0 is going to be never, 1 almost never, 2 sometimes, 3 almost always, and 4 always.
Okay.
So question number 1, my voice makes it difficult for people to hear me. When you're with your voicing issue,
so I do when I have the loss of my voice, it's definitely high. But if it doesn't happen all the time,
yeah,
like I may have those spouts maybe once, twice a month.
Okay.
So what would we rate that at?
I mean, how do you feel? Like, is it almost like sometimes?
Sometimes.
Like a 2?
Yeah, we could say a 2. That sounds right.
Okay. People have difficulty understanding me in noisy rooms.
I mean, if I have that problem when I lose my voice, yes.
But
otherwise,
overall,
I think I'm heard.
Okay.
Yeah.
So do you want to never?
Maybe put a 1.
1.
Because
okay.
definitely when I have my voice loss, for sure.
Okay. Question 3 is, my family has difficulty hearing me when I call them throughout the house.
No. 0.
0. Question 4, I use the phone it's all right. I use the phone less often than I would like to.
Less often.
So like talking on the phone.
I don't like to.
You think you're, no?
No.
0?
0. I talk to my wife less often than I like to, though, because I'm tired at the end of the day. My voice is tired.
Okay.
But not on the phone.
Not on the phone.
No.
I tend to avoid groups of people because of my voice. No.
No.
I speak with friends, neighbors, or relatives less often because of my voice.
Oh, yeah.
Yeah.
Maybe like a 3.
Okay.
Yeah.
Question 7, people ask me to repeat myself when speaking face to face.
Sometimes. So 2.
Okay. My voice difficulties restrict personal and social life. Question 8.
Maybe more of a 1.
Okay.
Yeah.
Question 9, I feel left out of conversations because of my voice.
Yeah. I'd say a 2 for that. And I say that because even when I'm trying to read like a book to my son, like I'll start reading a line, this is a children's book, and all of a sudden I feel like I have to swallow before I can read the next, before I take a breath, because I feel like this phlegm is just flooding down. And I feel like it takes away from I'm still reading to my son, but I feel like I could really give more in that moment, and it kind of just is kind of like trying, it's taking my mind off, being there with my son.
Right. Question 10, my voice problem causes me to lose income.
Not yet.
Oh,
0.
Okay. 0. All right.